Hello, Dr. Leona Allen, founder of Freedom Health Systems, and I just want to say hello this Tuesday afternoon and share some more information about heart disease. As many of you know, February is Heart Awareness Month, and I've been just really sharing a lot of information this month about heart disease and some of the common myths and what we can do to prevent it. So if you're watching, be sure to share this information with someone you love, because if you get the right information, it can really, change or save your life. So before I get started, I want to make sure you're aware that in my office in Stockbridge, I'm having a workshop that'll go more into details regarding this topic. I'll be sharing a lot of information about the myths and the things that we're told to believe about heart disease that really aren't true, and how to prevent it and how to test for it and things of that sort. So it's a really good, informative workshop. It's about an hour and a half long, and it is live in my office. I know some of you have signed up, so I look forward to meeting you. But for those of you who are interested, some of you don't live in the area, and we're also interested in some webinars and things like that. So let me know what you want, and I can make it happen. But for now, it is a live workshop. It's not in webinar format yet, but we can do that in the future. So again, please share, comment, and just let me know what I can do to help you understand this topic. So what I'm going to do is just really kind of review what causes heart disease. And when I'm talking about heart disease, I'm referring to things such as high blood pressure, high cholesterol, things that lead to heart attack and stroke, heart palpitations, things of that sort. And a lot of us are led to believe that cholesterol, salt, fat are the major causes of heart disease. But what really people don't really understand is that cholesterol, the benefits of cholesterol, and they're not getting all the information that'll help them make the right decisions to get their health back. And also, some of you are also on medication and still dealing with issues with heart disease and things like that. So hopefully after the next 5-10 minutes when I'm done, it'll give you a better understanding, and it will encourage you to sign up for this workshop so that you can get a lot more information. So please consider spending an hour or so with me this Saturday, because it can really, I can guarantee that it will not waste your time. So let's go ahead and get into the topic of the day of what causes cholesterol. And, I'm going to start with this. High cholesterol is not the cause of heart disease. And when we get our physicals, the first thing we want to see is what is our cholesterol levels. That's one of the first things they look at. And if it's high, they want to put you on medications. And if it's normal, they really don't do anything. But what people don't understand is, in my practice, in my clinic, I've seen more issues with normal or low cholesterol than I do with high cholesterol, and I'm just going to give you an overview of why that really happens. So cholesterol is essential for good health, and a couple weeks ago I did talk about the benefits of cholesterol, and also in my feed you can find some articles that I've written about it as well. But just really quickly, 3 things that how cholesterol is essential is it's every cell in the body, every cell, the trillions of cells that you have, every one of them needs it to function. It is critical for proper brain function, and also it's required for the production of hormones. So we got to really understand, we need to understand more about the benefits of cholesterol and stop really shying away with it so that we can finally get healthy. So when you're thinking of heart disease, a lot of people have other issues that are going on as well, and other risk factors, whether it's diabetes, obesity, other nutritional deficiencies, and stress. So usually when people are dealing with heart disease, they're dealing with other issues as well, and it'll really make sense once you understand this topic. I love to do research, and there's studies that show that there's a correlation between low cholesterol and higher levels of heart disease. And there's been studies that show that higher cholesterol has been associated with longevity and a good brain. So, when you're thinking about this, like, wow, when you study the healthy people in society, they're actually having high cholesterol levels. And then when you're looking at countries with low longevity, they have lower cholesterol levels. So this is a type of information that really makes you sit and think about what's going on, because ever since we've learned about prevention and reducing our fat and cholesterol and start eating things like margarine, heart disease has increased immensely in the last few decades. So since we started introducing this low-fat lifestyle, people have been getting sicker and sicker as a result. So the question is, so if cholesterol doesn't cause heart disease, then what does? And to summarize it, and I'll break it down even more, but really it's chronic cellular inflammation. Again, the core of what I do and the core of my programs is to create healthy cells. Our bodies are cells, and the healthier your cells, the healthier is your body. So the longer your cells live, the longer you live. So when you start dealing with chronic cellular inflammation, that is when you start having not just heart disease, but other diseases that are very common as well, such as diabetes, autoimmune disease, neurological illnesses, and things of that sort. So, but it's specific for heart disease. I don't want to go too into the scientific part very much. I'll do more of that on Saturday. But there's LDL, which more of you are familiar with as bad cholesterol, and HDL. And it's not true. It's not good cholesterol and it's not bad cholesterol. They just have different functions. But just really briefly, I'm going to talk about oxidized LDL, and that's what injures the arterial wall, and this causes the inflammation that leads to plaquing or the blockage in the arteries. Okay, so I'm going to go deeper in just a moment. So these are the particles of the LDL cholesterol. So cholesterol is carried in particles. So again, that's why it's not the total cholesterol that matters. It's the particles that carry the cholesterol. So what I'm referring to are LDL particles. And there's different sizes, but the smaller the particle, the more they oxidize. So when we're talking about heart disease, I'm talking about the oxidation of the smaller LDL particles. Because what happens is it gets into the lining of the arterial wall, causes the plaquing, and when the plaquing breaks in the body, that's a heart attack, and when it breaks in the brain or causes a lack of blood flow in the brain, that's known as stroke. So this is really the main issue that's causing the plaquing. But then you have to understand what is causing the plaquing in the first place. And there's a test that I do for this, and a lot of people, when you get your major, your regular physical exams, this isn't run, and it's called the NMR, and what it does is it looks at the particle size and number. So when you have a higher particle size, there's definitely an inflammatory process going on, but the smaller those particles, the more at risk you are for heart disease. And this is the type of stuff that I will be going more into when you sign up for the workshop today, because it's just something that it's better to explain when I have all my props and pictures, and it takes a lot of time because a lot of people just aren't familiar with it. All right, so what really causes the heart disease, and again, this is a summary, but we understand it's the plaquing, but what leads to the plaquing in the first place? So again, it's not the total cholesterol. I'm talking about the particles that carry the cholesterol, and then more specifically, I'm talking about the smaller particles. So the more oxidation and inflammation, the more small particles that you have. So let's talk about what causes this actual oxidation and inflammation. And there's three major things. Again, heart disease is a lifestyle illness, so that's why a lot of these things can be prevented when you have the right information. So the first one is environmental toxins. You can't agree that a lot of us are in a very toxic environment. And I'm not just talking about air pollution It's a lot of the water we drink, the pesticides, the chemicals in our environment, in our cleaning materials, and I mean, just everywhere. I mean, we are breathing in probably 500 chemicals per day. It's just exposed everywhere. It's, you know, and a lot of our products that we wear, a lot of products that we put on our skin, it's everywhere. And if you're not regularly detoxing on a regular basis, all it does is accumulate and cause a lot of damage in the body. So environmental toxins causes this oxidation and inflammation, and that's why it's really about getting to the underlying problem and helping the body get rid of this stuff and not just masking it with drugs or medication. And another major cause of oxidation and inflammation are really a lot of the foods that we're putting in our bodies. I'm talking about the processed carbs and sugars and grains. A lot of these things are extremely toxic, and a lot of us are eating too many of those foods that are extremely, they're non-foods. We're eating to live, but we're not, I guess we're living to eat, but not eating to live. We're not giving our bodies foods that nourish our body and heal our bodies and restore our bodies. We're just more eating for the taste, but not really thinking about what's in those foods and what it's doing to us. So a lot of times just cleaning out your body and putting in the right things is huge, but you got to understand how far it has really gone and what the barriers are, because sometimes we're so far along that we can't, what happens is that we can't just change our diet and it goes away, because so many things have accumulated in our liver and our kidneys that we need to actively detox and purge these chemicals from our bodies so that we can get well. And that's really what I help people with. So to kind of review, the two things that causes the oxidation and inflammation are the environmental toxins and a lot of the processed foods out there. And of course there's stress, emotional stress, physical stress, and there is a genetic component to it. But a lot of times you got to take a very holistic approach to this. Not just look at one thing or the other, but you got to look at the whole thing. You got to look at what you're doing, what you're thinking, what you're eating, how you're eating, what you're eating, when you're eating. I mean, there's so many factors that need to be involved because we have so much stacked against us right now that it takes more than just one therapy these days. We got to take a multi-therapeutic approach to get well. And the fortunate thing is there are solutions. There are natural solutions. And there are predictors. There's lab numbers that you can look at to kind of see if you're at risk. Because what a lot of people don't realize is one of the first symptoms of heart disease is a heart attack. You could be suffering and not even know it. And that's why I'm taking this time to share this information today so you can take these steps to prevent it. So even if you think you're feeling well and you don't think you have this issue, it doesn't hurt to get checked out. It doesn't hurt to get the information. It doesn't hurt to learn from doctors like myself that are really passionate about educating people about topics such as this. So again, I'm going to go into this more on Saturday, but looking at things like triglycerides, HDL, the NMR, vitamin D levels, fasting glucose, hemoglobin A1C. Believe it or not, a lot of these numbers, once analyzed properly, can determine if you are at risk of heart disease. You know, HA1C, yes, that's a hemoglobin A1C, yes, that is a diabetic marker, but as you know, diabetes does put you at risk because of the high insulin and glucose levels cause the oxidation and inflammation that can lead to the plaquing that can lead to heart disease. So you got to kind of follow the trail, I like to say, and get to the bottom of all these underlying issues. So just things you got to do is really educate yourself with the right information. Eating clean, avoiding all these processed carbs, sugars, and grains. Eating healthy fats, okay? It's not the cholesterol, you know, cholesterol and fat isn't bad. It's those trans fats. It's in these processed foods that are bad. So really stay away from these unhealthy trans fats. Stabilizing your blood sugar levels, especially for those who are diabetic or pre-diabetic. You got to stabilize those blood sugar levels. address those toxins and open up those detox pathways, because they do accumulate in your body over time, and you really need to get that stuff out. And also get the right test. Work with someone that understands the body and how it works and understands prevention. So once again, this is Dr. Leona Allen, and I look forward to meeting some of you this Saturday. And if you haven't registered, there's still time. Seating is limited. It's not going to be a very big workshop. I like to keep them smaller so I can really focus on other people's questions. So there's just a few seats available. So if you are interested, take some time, go to drleonaevents.com, reserve your seat, and look forward to sharing more of this information with you and in the future. So I am out. Y'all have a great day, and look forward to seeing some of you real soon. Bye.